Hi everyone, Rachel from North Brisbane Psychologists. Today I'd like to talk a little bit about burnout. We put a post up a couple of weeks ago and I promised my social media helper, Isabella, that I would make a video about professional or carer burnout because there were a lot of questions on that post about burnout, and I'm finally getting around to making this video. And I can't believe I haven't made a video on the topic of burnout at all, ever, because it was the topic of my PhD, which I finished in 2006. My PhD was actually in organizational psychology, but I was interested in the question of what are the factors that relate to whether or not a helping professional experiences burnout. So I might start with a bit of a definition. I'll give you the academic definition of burnout that I used in my PhD thesis, and then I'll look at it in more everyday language, look a little bit at the causal factors in burnout, and then say a couple of things about what you can do if you are living in a state of perhaps chronic low-level burnout, as a lot of people who come to see me are, as opposed to being in major burnout, which if you hit that, you normally can't function very well and your body really tells you you need a break. Some people have experienced that, I'm sure. There's so much to say on this topic that I'm not going to be able to cover very much, but let me see if I can make a few basic points. So in my thesis, I used the Maslach burnout inventory and her model, Cassandra Maslach, I don't know, in academia you only learn people's surnames, of course. Christine Maslach, that was it. She looked at 3 factors of burnout. She said that she looked at social workers, police officers, nurses, doctors, psychologists, teachers, these sort of helping professionals who deal with a lot of stressors, high demand in their job, and need to do a lot of emotional labor. In other words, manage their emotions, empathize with other people, perhaps quite often. So these are the professions who tend to experience higher levels of burnout. Of course, we also know that carers can experience burnout, parents can experience burnout. So see if these 3 factors have ever applied to you. The first one is emotional exhaustion. So not just physical exhaustion, but a feeling of just being at the end of your rope, at the end of your tether. The second factor in the academic conceptualization of burnout is called depersonalization, which really just means that we start to stop caring. You know, the people who we normally would feel enormous love for or care for, whether it's our students, our patients, our clients, or even our children, the people who we need to be of service to, we start to shut down. We start to dissociate a little bit. It's called depersonalization. We stop caring. We lose the love. That's depersonalization. And the third factor is diminished personal accomplishment. See, I can remember this all off by heart because I wrote these words so many times in my thesis. Diminished personal accomplishment is where we start feeling like we're not making a difference anymore. We lose the dream. You know, the fantasy is perhaps shattered a little bit, and we start to think, why bother? Am I really, and it goes with feelings of not good enough. I'm not good enough, I'm not achieving enough, and we're not getting a sense of achievement or accomplishment or self-esteem anymore from our role. So exhaustion, depersonalization, and diminished sense of accomplishment. This is the academic way of construing it. But if you look at websites on the topic, they talk about, and you might relate to these more so or instead of, they talk about cognitive difficulty, so difficulty concentrating, making poor decisions, can't think clearly, memory problems, and increased anxiety. So sort of these cognitive emotional symptoms of burnout. Then we might have physical symptoms of burnout. Aches and pains in our body, headaches, loss of libido, dizziness, nausea, tightness in the chest and even chest pain, loss of appetite or overeating, comfort eating, undersleeping, oversleeping, increased use of drugs and alcohol, and social withdrawal. That's getting more into the social symptoms. So social withdrawal, a sense of apathy, a sense of resentment towards your job, and that might spill over into other people in your life, disinterest in the things that used to bring you enjoyment and happiness. So you can see from this description of the symptoms of burnout, it seems to be very closely related to depression. But it's the kind of depression that maybe lacks some of the other symptoms of clinical depression. It's not necessarily to the point where you feel like life is meaningless and that you are worthless. Those symptoms may or may not be present, but it's a sense of just being absolutely exhausted, at the end of your rope, don't care anymore, things aren't bringing me joy, and it's got these physical symptoms that we see in anxiety and depression as well. So maybe you relate to some of those. So there's some really good articles on burnout, some that have surprised me that I didn't come across in my PhD research. Things like an article I found in one of the HR magazines, Managing People. Burnout at work is not just exhaustion, it says, it's also about loneliness. So this was a factor that didn't come up in my research, but it makes so much sense. You know, we can be surrounded by people. Perhaps you're a lawyer or a doctor and you work in a busy workplace and there are people everywhere, but you still feel lonely. You still feel a sense of isolation. It seems that a great antidote to burnout, or a remedy, is to feel a sense of connection, to assuage the stress and the loneliness that can come from stress. You know, we all know that if we are under the pump and under pressure, things feel much more manageable if we're not alone, if there are other people in it with us together. So the more exhausted, the lonelier we tend to feel, and the lonelier we tend to feel, the more exhausted we can get. So it's a bit chicken and egg. So social support seems to be a big part of managing and alleviating burnout. The old chestnut of self-care applies here as well. If we're not sleeping, we're not eating, we're overeating, we're using too many drugs or too much alcohol, or finding other unhealthy ways to cope, we need to go see someone or make a plan or have some sort of accountability around doing things differently. That is obviously not going to help us. The basics of self-care, getting enough sleep, getting your macronutrients, eating a balanced diet, getting some exercise, having a shower regularly, just going to the doctor if you need to, going to the dentist if you need to, getting a massage if that's something that you like. These very basic things that help us look after the systems of our body really are so important, because it's so easy to feel exhausted, feel lonely, and then substitute connection and support with drugs, alcohol, and other addictive behaviors. So we need to kind of practice that form of self-compassion and self-empathy, which I call active self-compassion, when we do nice things for ourselves, we look after ourselves. Now, what else did I want to tell you about burnout? That social connection, I can't say enough about it, because feeling misunderstood or unappreciated by the people around you is such a big factor for burnout. So expressing your needs, whether they're needs around time, space, and rest, or whether they're needs around appreciation, understanding, empathy, shared responsibility. You know, in every form of human suffering, at the base of it, as I've spoken about before, are some very precious unmet needs, some core needs that we need to, or values you could call them, that we need to pay attention to. So we need to ask the question, what am I needing that I'm not getting right now? That's a really important inquiry. What do I want that I'm not getting right now? So if we can, I'll leave it on that question, because I think it's such an important question for all of us to ask ourselves from time to time. There's a great burnout inventory that's quite simple, a checklist for yourself for burnout on mindtools.com. I'll see if we can put it in the post. And if you have any questions at all about burnout, after having listened to this, pop your questions in the comments below. Okay, until next time, bye for now.